We are a 200-bed nonprofit hospital located in the state of Arizona in the greater Flagstaff area. We are a teaching hospital that focuses on the treatment of orthopedic and cardiopulmonary conditions. The organization structure is set up with the goal of allowing for efficient communication among the various departments and rapid integration of new techniques and services, allowing the hospital to be a dynamic force of change to align itself with new evidence from research. With this goal in mind, direct communication with supervisors and administrators, as well as interdepartment communication, is an integral part of the organizational hierarchy. At the top of the organizational hierarchy is the Board of Directors, which is made up of a diverse group of individuals who each bring a different perspective and expertise to the discussion. Members may include professors and deans of nearby health profession colleges, healthcare activists within the local community, and innovative local business leaders. The Board of Directors oversees two main divisions, the Administrative Division and the Medical Division. The Administrative Division is made up of Billing and Coding, Human Resources, Marketing, Admissions, and Accounting departments. The head of each individual department makes up the Administrative Board. The Medical Division is made up of Lab, Rehabilitation, Physician, and Surgery departments. Similarly to the Administrative Department, each director of the various medical departments work together as the Medical Board. Department heads will continue to work in their respective field with patients and alongside coworkers for 20% of their weekly work hours. This will allow those with more administrative roles to still be a part of the clinical practice and delivery of care. The Administrative Board and the Medical Board together report directly to the Flagstaff Memorial Board of Directors to assure continued communication through all departments. Looking specifically at the rehab division of the medical side, it consists of PT, OT, and speech. The Physical Therapy Department will consist of 6 physical therapy assistants and 3 physical therapists, one of which will be the primary leader for that discipline. Each discipline will select one such peer leader to serve as a primary leader. They may be selected on years of experience, advanced degrees or schooling, or interpersonal skills such as communication with patients and conflict resolution.
Flagstaff Memorial Hospital strives to provide the community with optimum care. To assess our delivery of care, quality measures have to be reviewed and revised as needed. Quality measures typically fall into 4 categories: structure, process, outcome, and patient experiences. Structure assesses the features of a care setting, such as the staffing and capabilities of the physical therapy staff, the policies the staff follows, and the availability of resources. To meet the criteria for the structure quality measure, our facility has an accreditation body perform a site visit annually to determine our ability to follow the hospital policies as required by national laws. And we have an individual director over labs, rehabilitation, physicians, and surgery who determines the availability of resources, the hiring and firing of the staff, and the capabilities of the staff in their particular area. Process measures assess whether the providers are giving each patient services that are consistent with the recommended guidelines for care, such as a set exercise regimen for specific orthopedic surgeries, for example, total hip replacement and total knee arthroplasty, that will be used for each patient post-operatively. To meet the criteria for the process quality measures, our facility has assigned a lead therapist to do monthly chart reviews and assess quality of patient notes to ensure appropriate documentation for reimbursement purposes. We have assigned a lead therapist to be a mentor for other therapists, and we have monthly team meetings to assess effectiveness of the recommended exercise guidelines in place and to update staff on developing technology and evidence-based practice. Outcome measures look at the patient's health after receiving care and the effects the care has had on the patient's health status and function after receiving care. These measures are obtained by determining mortality and morbidity rates. To meet the criteria for the outcome quality measure, our facility has the Human Resources Department of the hospital review information from electronic medical records about patient readmittance, primary diagnosis, mortality, nosocomial infection, and etc. Patient experience measures include feedback on the information given to the patient regarding their condition and whether the doctors explain test results to the patient and bedside manners. To meet the criteria for the patient experience quality measure, our facility has a physical therapy satisfaction form that will be given to the patient with their discharge paperwork. This survey inquires about the care they received and how well information was explained to them. For example, about precautions after surgery, test results, outcome measure results, and etc. A hotline number will also be given at discharge for further information and inquires about their condition or if the patient requires further assistance within their home upon discharge.
Physical therapist salary in the United States. In 2012, the median pay for physical therapists was $79,860 annually for the median. In 2014, the mean annual wage increased to $83,940 for the median. In 2014, the 90th percentile received $116,090 annually. 2014, the 75th percentile received $96,060 annually. Physical therapist salary in Arizona. In 2014, the annual wage range was $84,030 to $127,900 for physical therapists. In the non-metropolitan area of southeast Arizona, physical therapists earned an annual mean wage of $127,090. In the Lake Havasu City, Kingman, Arizona metropolitan area, physical therapists earned an annual mean wage of $117,560. In the Phoenix, Mesa, Glendale, Arizona metropolitan area, they are ranked with one of the highest employment rates for physical therapists at 2,950 jobs, receiving $83,840 annually. In the Flagstaff, Arizona area, where our hospital is located, physical therapists earn an annual mean wage range of $76,840 to $81,740. Our rationale for physical therapist salary at Flagstaff Memorial Hospital. Flagstaff Memorial Hospital is located in a state where the annual wage tends to be higher. Inpatient physical therapists are in higher demand in the western region. 2 full-time physical therapist positions will be offered at $95,000 annually. 1 full-time lead physical therapist will be offered $115,000 annually because of more responsibilities and more involvement within the hospital operating system. Negotiations will be allowed to no more than $5,000 above the offered amount for these positions. If the therapist has a specialty degree in cardiopulmonary or geriatrics, they will earn an additional $2,000 per year. Physical therapist assistant salary in the United States and Arizona. In May 2012, the median pay for physical therapy assistants was $52,160 annually. In 2014, the annual wage of physical therapist assistants in Arizona ranged from $22,670 to $49,030. In the Phoenix, Mesa, Glendale, Arizona metropolitan area, they had one of the highest employment rates for physical therapist assistants at 1,000 jobs, and they received $39,860 annually. Rationale for physical therapist assistant salary at Flagstaff Memorial Hospital. Due to inpatient being more involved compared to an outpatient setting, the PTAs will be paid closer to the median wage of the United States. The Phoenix, Arizona area earns less than the median, so the physical therapist assistants will earn slightly below the median annual wage compared to the United States median. 6 PTA positions will be offered at $47,000 annually. Negotiations will be allowed to no more than $2,000 above the offered amount for these positions. Supply costs. The amount spent on initial equipment and supplies for the PT department at Flagstaff Memorial Hospital is $146,821.74, with tax included. These items will also be shared with the outpatient PT department of the hospital.
Excelsior Marketing utilizes a community-based approach aimed at geriatric, family, and younger adult populations. Community marketing will allow the local community to feel connected with our outpatient and inpatient clinic. Our marketing aim is to facilitate a loyal bond between excellent healthcare practitioners and patients. By providing a transparent and unique image of the company, Excelsior will become an invested part of the Flagstaff community. Excelsior has an outgoing and community-integrated staff. The Excelsior Incentive Program aims to provide those already involved with the community a stipend for their efforts. Excelsior will award up to $2,000 per employee annually for participation in health-related and Excelsior-supported activities. For every 2 points the clinician receives, they will receive a $100 stipend. These activities include hosting an in-service, becoming a clinical instructor, providing a pro bono lecture, and other communal activities. Other avenues of community involvement include financial support to children's organizations that promote physical activity like recreational baseball or a soccer league. Scholarships will be offered to local high school seniors pursuing a health professions major. Also, financial support of the local Flagstaff Public Radio, which will include ads for public Excelsior events. Annual marketing expenses of Excelsior will be capped at $32,200. This includes social media marketing, the Excelsior Incentive Program, Excelsior approved community event expenses, organizational support, FPR, and communal monetary awards. Facebook, Instagram, and Twitter accounts will be utilized for free marketing and for transparent customer service. Our lead PT will be responsible for professional communication through social media for events relating to the clinic and responding to posts made by the community. These personalized responses will allow Excelsior to communicate publicly and allow others to see the company's caring and devoted demeanor.
Policies and procedures at Flagstaff Memorial. Before getting into some of the specifics, let us take a step back. What is a policy? Policy is a broad statement of an expectation that guides decisions regarding actions to be taken. It's kind of like your problem list when thinking about a patient. They are the things that need to be addressed to be successful. What is a procedure? Procedures describe a particular way of accomplishing an action. It's kind of like your treatments for a patient that address your problem list. They outline our actions to fulfill the policies. So what are some of our policies? Scope. To ensure safety of our patients, our therapists are expected to practice within their realm of knowledge only. We ask that each therapist practices within the scope defined by their respective governing body. HIPAA. Patient privacy is a high priority at Flagstaff Memorial. We take every step possible to protect the information of patients, such as logging out of computers when finished and providing a password when obtaining personal health information over the phone. Dress code. Professional image is projected in each employee's overall appearance. Patients, visitors, prospective employees, and other customers form impressions and make decisions during their initial interactions with our employees. Therefore, we ask that all employees dress appropriately and professionally given their specific work environment. Research within the hospital. Here at Flagstaff Memorial, we are an evidence-based hospital. Therefore, we support new and upcoming research by allowing research to be done within our hospital. Any potential research must be approved by our medical board to ensure there is no known substantial risk to any patient who may choose to participate. Emergency procedures. Knowing what to do in an emergency, whether that's during natural disasters, gunmen/intruders, etc., is pivotal to protecting those in our hospital. In the event that one of these tragic events happen, each of our employees take our emergency procedure course prior to their first day so they can help direct patients and guests to safety. There are many more policies and procedures that can be accessed by our employees via the learning website online. Each policy and procedure is expected to be read through before their first day of work.
Since we are a 200-bed hospital, we have a mainframe computer and an information technology center. The mainframe computer contains all passwords and can track who has viewed patients' information. All of the computers outside of the patient's room that contain the EMR are password protected. There is also a computer in the inpatient gym that has an EMR and can be used for documentation as well. Prior to starting treatments for the day, each PT and PTA will have printed off papers for each patient they need to see. Those papers will have the room number, diagnosis, and notes from the physician. The PT uses that paper to take notes on during the evaluation, examination, and treatment. When a doctor orders inpatient PT the day of, the PT receives a page. The EMR system and pagers are used to abide by HIPAA standards. Documentation of treatments can be done on the hospital's database, in the PT office, or in the inpatient gym. Evaluations are done through voice recognition in the PT office with the door closed. Our integrated health information system allows data to be pulled by human resources to review and interpret the information. Human resources has all staff records centralized, such as demographics, payroll, productivity reports, quarterly reports, and benefits. Some of the roles we have for documentation includes everyone must abide by HIPAA. PTs are only to look at imperative data on the EMR that relate to the patient's plan of care. When using computers in the hallways, PTs should be aware of others around and make sure no one is lingering and can read the information on the screen. When done with the computer, the PT or PTA should log out and lock the computer system before stepping away. Notes must be entered into the EMR within 8 hours of seeing the patient. Also, papers that are used to take notes on during daily treatments must be shredded. For communication, our hospital staff strives to be effective communicators and professional with patients and among all staff. We aim for a monthly patient satisfaction rate of 90% or higher. Listening and having effective communication is a large part of that. If staff does not know an answer to a patient's question, they are to say, "I do not know, but let me find out for you." A timely response is then required. The PT staff must introduce themselves when entering the patient's room. They must clearly state the objectives of that day's treatment and actively listen to the patient's concerns. All guests in the room must be acknowledged and greeted as well. If a patient is returning home upon discharge, the patient will be provided with a paper handout of exercises to continue at home. So for example, if a patient had a total knee replacement, they will be given a handout of exercises just for total knee replacement patients. At the end of each patient's stay, the patient is given a physical therapy satisfaction survey with their discharge paperwork. If a patient refuses to see a physical therapist 3 times, they can be discharged from therapy against medical advice. In order for this to happen, though, the patient must be oriented and have the ability to make the decision to refuse therapy. The patient also must be given all the risks that can occur from not participating in therapy. The against medical advice letter will then be put into the EMR and sent to the physician as well. If staff have any concerns, there is an open door policy. Staff need to talk to their direct supervisor first unless they do not feel comfortable. Then they can report to the rehab manager. Some rules we have for communication include: always listen. Listen to the patient and to your colleagues. Avoid medical jargon. We want our patients to understand what we are saying in the room. Another aspect of a business is risk management. In order to decrease risks that are associated with a healthcare setting, we have several policies and procedures in place. Child and elderly abuse, discrimination, sexual harassment, and workers' compensation was talked about previously. But for incident reports, those must be filled out if anybody gets injured on the job. They must report to HR and fill out the form, and also report any incidents to supervising manager. Also, for people exposed to bloodborne pathogens, they must fill out an incident report. We have eye washing stations on each floor next to the nurse's station. For employees that transfer patients, they must go through an hour employee training body mechanics course. This is to decrease the risk of injury. Employees will also be provided with a body mechanic and transfers handbook. In this handbook, it talks about the weight limit for certain types of transfers. PTs and PTAs must hand wash or sanitize before entering rooms and after using the restroom or eating. Staff must stay up to date on vaccines and annual flu shots. HR keeps a record of these. We have multiple policies in place for patient safety. Patients are assessed for fall risk immediately at the evaluation. They will be given a yellow medical bracelet if they are at increased risk for falls, and they must wear that during their stay. Patients also need to be wearing a gait belt during ambulation. If a gait belt cannot be used, the patient must be followed by a chair. There is a safety hotline number for patients that feel mistreated or uncomfortable with any situation. Patients also have the option to fill out a complaint form through the Administration of Patient Safety Office. Complaints are addressed within 5 days, and the patient will receive either a written or verbal reply. When patients are in bed, both rails must be kept up in order to prevent falling out of bed. Patients also must always wear their armbands, and if they need to get up to use the restroom, they must call the nurse. There are several rules in place for visitors. There is a maximum of 6 guests allowed in a room at a time. This number can be lower depending on the severity of the condition. Guests are allowed in the room during visiting hours. If they want to stay overnight, they must obtain permission from the head nurse. If a guest is ill, they are not allowed into the hospital wings to keep the patient safe. Children must be supervised. Guests may be asked to step out of the room at the request of the healthcare provider during certain procedures or testing. Also, no weapons or firearms are permitted in our building. We also have safety data sheets that can be found online or in the main nursing station of each floor. These data sheets are updated annually. Personal protective equipment such as gloves and gowns should be worn when needed to reduce risk of bloodborne pathogens. Signs will be posted outside of patients' rooms if personal protective equipment is needed. This equipment must be disposed of properly. In regards to staff food, the food should be stored in the proper refrigerators labeled for food. Food should not be out in the open and must be eaten in staff break rooms. For utilization review and outcome measures, treatment efficacy must be monitored and revised as needed, and clinicians must stay up to date on research in order to provide optimum care. One method of analyzing our care is by having each patient fill out the satisfaction form after discharge that focuses on billing accuracy, cost, courtesy of staff, privacy, and treatment satisfaction. Also, HR gathers information and analyzes hospital-acquired infections, occupational safety and health administration injuries, employee turnover, emergency department wait times, readmission rates, and mortality rate. Patients can also look at Medicare's Hospital Compare website for information on our hospital's general information, readmission rate, complications, patient satisfaction, and much more. Also, for staff, they are given biannual reviews that focus on performance, productivity, and quality of documentation.